So we are studying about respiratory system. So this is the last topic in the respiratory system, that is acid-base balance. How the inspiration, how the exhalation is maintaining the respiration. The respiration is maintaining the acid-base balance. Because very important. I already told you that if the hydrogen ions are more in the blood becomes acidic, which is more dangerful condition, which makes the blood acidic. Acidic means it is near the danger level of the body, danger level to kill all the cells. Okay. So here we will talk about respiration affect the pH of body fluids because it regulates the amount of carbon dioxide in the fluids. Remember that CO2 reacts with water. CO2 reacts with water to form carbonic acid. So CO2 plus H2O. What will become? It will become H2CO3. Which which ions, H plus ions and H3, HCO3 ions are bicarbonate. The more hydrogen ions present in a body fluid, the low of pH, and fewer hydrogen present, the higher are pH. So basically here, if the hydrogen ions are increased, means what will happen? pH decreases. pH decreases. More hydrogen, more pH decreases. Less hydrogen, pH increases. So this is reciprocal, opposite. Hydrogen increases, pH decreases. Hydrogen decreases, pH increases. Okay. If the pH decreases, it means acidic because hydrogen are increasing. If the pH is hydrogen decreasing, it becomes alkaline. Okay, it is very important. You have to remember that. Understood here? Again, I am explaining. So basically, what is pH? pH is nothing but per hydrogen. So basically, whenever we are giving oxygen to the body, okay, cells respiration occur. So self-respiration, during the self-respiration, it will release carbon dioxide. Carbon dioxide. So carbon dioxides bond with hydrogen ions and will produce H2CO3. And it will become H plus HCO3. So this hydrogen is entering into the blood. Okay. It entering into the blood and making the pH levels decreases. So more hydrogen, less pH. So blood become acidic. So how this hydrogen ions will decrease means we have to eliminate carbon dioxide. Then carbon dioxide will not react with hydrogen, H2 water, and it will not produce carbonic acid. Okay, understood? So this is the formula we have to understood. Respiratory acidosis. Respiratory acidosis and respiratory compensation. These are the two points. Respiratory acidosis and respiratory alkalosis. Very important. Please view the concentration here. Respiratory acidosis occurs when the rate of or efficiency of respiratory decreases, permitting carbon dioxide to accumulate in the body fluids. The excess carbon dioxide results in the formation of more H ions, which decreases the pH. Holding one breath can bring more about a mild respiratory acidosis, which will soon stimulate the medulla to initiate breathing again. More serious cause of respiratory acidosis are pulmonary diseases such as pneumonia, emphysema, or severe asthma. Each of these impedes gas exchange and allows excess carbon dioxide to remain in the body fluids. What will happen? Respiratory acidosis means increase of hydrogen ions because more carbon dioxide, more hydrogen ions. More hydrogen ions, more blood become acidosis. It is the path you have to remember. Okay. Next. So this condition, the blood become acidosis. So we will call this respiratory acidosis. Means there is a problem in the respiration. Due to the respiratory problem, the blood become acidosis. So we'll call respiratory acidosis. Understood? Next is respiratory alkalosis. So most of the thing is that reduce of hydrogen ions. Means carbon dioxide is going, but oxygen is not coming. What will happen? Let's study about that. When the rate of respiration increases, carbon dioxide is evaporated, exhaled. Less carbon dioxide decreases H plus ion formation, which increases the breathing. Breathing fasting for your few minutes can bring about a mild stage of respiratory alkalosis. Babies who cry for extended periods, crying is a noisy exhalation, put themselves in this condition. In general, however, respiratory alkalosis is not a common occurrence. Several physical trauma and shock or certain stages of mental or emotional anxiety may be accompanied by hyperventilation and also result in respiratory acidosis. Alcohol in condition traveling into a high altitude may cause a temporary increase in breathing rate before compensation occurs. So basically, alkalosis is seen in most less condition, but acidosis is seen in which is in the most common condition. Okay, respiratory alkalosis here one example given that when cries, when baby cries, what will happen? He will excrete more. Carbon dioxide will release rapidly. So what will happen? Hydrogen ions decreases. You have to maintain the hydrogen ions, not to eliminate all the hydrogen ions. You have to maintain the hydrogen ions. Okay, if the hydrogen ions is eliminating, so what will happen? In the blood, head hydrogens are decreases. Hydrogen decreases, pH increases. pH increases, blood become alkaline. So we will call this condition respiratory alkalosis. Alkalosis. Okay, understood? So clear till now?
Yes, sir. Yes.
Next, respiratory compensation. Here, respiratory compensation. If pH imbalance, if we imbalance happen, what will happen? What will upper respiratory system do? Caused if pH imbalance is caused by something other than a change in respiration is called metabolic acidosis or metabolic alkalosis. Here, the reason is respiratory system. So we'll call respiratory acidosis. We'll call respiratory alkalosis. But here, the problem is not in the lungs. The problem is not in the medulla form. But the problem is in other system other than respiratory system. We will call metabolic acidosis. If pH decreases, metabolic acidosis. If pH increases, alkalosis. In either case, the change in pH stimulates a change in respiration. They may help restore the pH of body pH to normal. But here, the metabolic acidosis or maybe metabolic alkalosis will take the help of respiratory system to maintain the balance. Okay. Metabolic acidosis may be caused by untreated diabetes mellitus, ketoacidosis, kidney diseases, or severe diarrhea. What will happen? Metabolic acidosis. In this condition, H plus ions increases. Okay. So what are the causes? It may be diabetic, it may be kidney disease, it may be diarrhea. So these are the three conditions which will make metabolic acidosis. If we can't treat, okay, in such situation, high H plus ion concentration of body fluid is increased. Respiratory compensation involves an increase in the rate and depth of respiration to exhale more carbon dioxide, decrease H plus ions formation, which will raise the pH toward the normal range. So this is the respiratory system will help because to eliminate carbon dioxide to inhale oxygen. Okay. Next we have Metabolic acidosis. Metabolic acidosis is not a common occurrence, but may be caused by ingestion of excessive amounts of alkaline medication, such as those used to relieve gastric disturbance. Another possible cause is vomiting to stomach contents only. In such a situation, the HPS and concentration of body fluids decrease. Respiratory compensation involves a decrease in respiration to retain CO2 in the blood to increase express ion formation, which will lower the pH towards the normal range. But here, metabolic acidosis is not caused by any disease, but it will take in large amount of alkaline product, and some person will eat. Uh, some persons will take mostly. What will he will take? Number of things are there in marketing now, like poison. Hmm? Poison. Poison is alkaline. Mostly, it will decrease the H plus ions. So pH increases, the blood becomes alkaline. Alkaline, metabolic alkaline, alkalosis will happen. Okay. In that condition, all the body will damage. Poison is mostly alkaline. Okay. So there is a reason the respiratory centers also help, but if it is in normal level, it will help. In the normal basic level, mild problem, it will help. But it is more than mild, moderate, or severe condition, we need support of the oxygen. Okay. So this is all about respiratory system acid base balance. So we studied in detail about all the things which are related to the respiratory system, parts, anatomical function, physiological function, and relationship between other things. Okay, so we completed respiratory system. So if any doubt, you can ask related respiratory system. Next we have digestive system chapter. Next we have respiratory system is completed. Next one, digestive system. Main chapters are digestive system and urinary system, reproductive system. And then our syllabus will complete. We will complete very rapidly. Inshallah. So it remains most. It doesn't need this chapter. Already you are still study microbiology. So you are not going through that 22 chapter. So how many chapters you need? One, two, three, four, five, and six. Six chapters are there. So we'll try to complete in 2 to 3 books. So, so we'll conclude the class. If any doubts, you can ask.